Good afternoon. Today we will discuss about anatomy of the spleen and the pancreas. The spleen is an organ located in the upper left abdomen. In the adult, the spleen functions mainly as a blood filter, removing old red blood cells. It also plays a role in both cell mediated and humoral mediated immunity responses. In this video, we shall look at the anatomy of the spleen, its anatomical position, structure and vasculature. So spleen situation, it lies in between the fundus of the stomach and in the diaphragm. Characteristic features of the spleen. Spleen is highly vascular and elastic organ. Spleen is purple in color. This organ moves with respiration. This is not essential for life. Splenic parenchyma may regenerate after partial removal of it. Normal spleen contains approximately one-third of the total body platelets and a significant number of neutrophils. Then coming to the situation of the spleen. Spleen is located in the upper left quadrant of the abdomen under cover of the diaphragm and rib cage, and therefore cannot be normally palpated on the clinical examination. It is an intraperitoneal organ entirely surrounded by the peritoneum. The spleen is connected to the stomach and kidney by the parts of the greater omentum. There are few ligaments which supports or attaches spleen to the surrounding organs. First one is gastrosplenic ligament. This is gastrosplenic ligament. Gastrosplenic ligament is the anterior to the splenic ileum, connects the spleen to the greater curvature of the stomach. So gastric splenic is connecting spleen to the greater curvature of the stomach. And second one is splenorenal ligament. This ligament is posterior to the splenic ileum, connects the ileum of the spleen to the left kidney. And coming to the anatomical relations, so it lies in the close proximity to the other structures in the abdomen. Anteriorly, we can see in the image, anteriorly the spleen has a stomach, posteriorly diaphragm and left lung and ribs 9 to 11, inferiorly left colic flexor, and medially connected to the left kidney and tail of the pancreas. So coming to the external features of the spleen, these are very important. The spleen has two ends, three borders and two surfaces. Okay, then let's discuss about the ends of the spleen. This is the anterior end and this is the anterior end is expanded and is more like a border. It is directed downwards and forwards and reaches the mid axillary line. The posterior end is rounded and it is directed upwards, backwards and medially, and it rests on the upper pole of the left kidney. And three borders: the superior border, inferior border and intermediate border. The superior border is notched near the anterior end, then the inferior border is rounded, and intermediate border is also rounded and is directed to the right side. You can see on the image. And two surfaces: diaphragmatic surface and visceral surface. Diaphragmatic surface is convex and smooth. The visceral surface is concave and irregular. The visceral surface has the following impressions: gastric impression for the fundus of the stomach, and it has the renal impression, colic impression, pancreatic impression. So in the diaphragmatic surface, diaphragm will get attached to the spleen, and in the visceral surface, The remaining adjacent organs will get attached on the visceral surface of the spleen. So the pancreatic impression also very important. And then coming to the spleen, spleen is highly vascular organ. It receives most of the arterial supply from the splenic artery. This splenic artery arises from celiac trunk. You can see this splenic artery arising from the celiac trunk and supplying to the spleen. As the artery reaches the spleen, it branches into 5 vessels, each supplying a different part of the organ. And venous drainage occurs through splenic vein. You can see here splenic vein. And these splenic veins drains into the hepatic portal vein. And clinical anatomy of the spleen, splenic rupture. This tends to occur when there is a localized trauma to the left upper quadrant. So, any trauma to the left upper quadrant may cause splenic rupture. When the spleen is injured, it bleeds profusely into the peritoneal cavity. And another clinical anatomy of the spleen is palpation of the spleen. Usually a normal spleen is not palpable. An enlarged spleen can be felt under the left costal margin. During inspiration, palpation is assisted by the turning patient to its right side. Okay, and splenomegaly, enlargement of the spleen is called splenomegaly. There are so many factors, causes and diseases contributing to the splenomegaly. And splenic puncture, spleen can be punctured through 8th or 9th intercostal space in the mid-axillary line using lumbar puncture needle. When it is enlarged, it can be punctured through anterior abdominal wall to avoid laceration of the spleen. Note, the patient must hold his breath during the procedure. Nerve supply, sympathetic fibers, these are derived from the celiac plexus. And lymphatic drainage into these drained into the pancreatico-splenic lymph nodes. And functions of the spleen, phagocytosis function, hemopoiesis, that is production of the blood function, immune responses and storage of the RBC. Accessory spleen, some people, less than 10% of the population, have this accessory spleen. Accessory spleen means one or more small splenic masses if present in the one of the peritoneal folds close to the spleen or near to the spleen is called accessory spleens. The diameter of the accessory spleen is usually 1 centimeter. These are small spleens present near to the satellite to the spleen. These are called accessory spleens. These spleens are present about 10% of the individuals. Next topic is, we will discuss about pancreas. Anatomy of the pancreas. So the anatomy, the pancreas is an abdominal glandular organ with both digestive and hormonal functions. In this video, we will look into the anatomy of the pancreas, its structure, anatomical position and vascular supply. Location, the pancreas is more or less transversely across the posterior abdominal wall at the level of first and second lumbar vertebrae. So this is the anatomical position. It extends across the posterior abdominal wall from the duodenum. Location, the pancreas lies more or less transversely across the abdominal wall at the level of first and second lumbar vertebrae. Size and shape, it is J-shaped organ set obliquely. It has head, neck, body and tail. It is about 15 to 20 centimeters in long 2.5 centimeters broad, 1.2 centimeter thick, and weighs about 90 grams. The pancreas is divided into, I already told you earlier, four parts: head, neck, body, and tail. Pancreas relations within the abdomen. The pancreas has direct anatomical relations to the several organs in the abdomen. These are the stomach. You can see in the image, stomach separated from the pancreas by the lesser sac. The stomach and the pylorus lie anterior to the pancreas. And duodenum, the C-shaped duodenum curves around and outlines the head of the pancreas. Spleen, spleen is located posteriorly and laterally to the pancreas. So these are the anterior and posterior relations of the spleen. These are the posterior relations, bile duct passing through it. And okay, then coming to the structure of the pancreas. Usually pancreas is typically divided into five parts: head, neck, body, and tail. The head is the widest part of the pancreas. It lies within the C-shaped curve created by the duodenum and is connected by the connective tissue. Neck. The neck is located in between the head and the body of the pancreas. It overlies the superior mesenteric vessels. Body is centrally located, crossing the midline of the human body to lie behind the stomach and to the left of the superior mesenteric vessels. Tail. The left end of the pancreas that lies within close proximity to the hilum of the spleen. It is contacted within the splenodenal ligament. This is the only part of the pancreas that is intraperitoneal. So duct system, the exocrine pancreas is secretes so many hormones, so there are so many ducts present in the pancreas. You can see here the ducts of the pancreas. It is composed of approximately 1 million busy-like clusters of cells called acini connected by short intercalated ducts. So blood supply to the pancreas. See, the pancreas is highly vascular organ. The pancreas is supplied by the pancreatic branches of the splenic artery. The head is additionally supplied by superior and inferior pancreoduodenal arteries, which are the branches of the gastroduodenal arteries. Venous drainage. The venous drainage of the head of the pancreas is into superior mesenteric branches of hepatic portal vein. I repeat, venous drainage of the head of the pancreas drains into superior mesenteric branches of hepatic portal vein. The pancreatic veins draining the rest of the pancreas via splenic vein.